Professor, Physician, Epidemiologist. I am Dr. Sri Banerjee. Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University, and with a joint faculty appointment with Ross University School of Medicine. And in this video, I'm going to be going over a highly neglected tropical disease, which is known as schistosomiasis. And this is a tragic disease that is caused by, believe it or not, worms. These parasitic worms both cause an acute and a chronic disease, and actually, believe it or not, affects millions of people. And yet it's a neglected tropical disease. People are infected during routine agricultural, domestic, occupational, and recreational activities, which expose them to the infested water. Of course, lack of hygiene and certain play habits of school-aged children, such as swimming or fishing in infested water, this may make them especially vulnerable to infection. How do you control? Well, focus on reducing disease through periodic large-scale population treatment with praziquantel, a more comprehensive approach including potable water, adequate sanitation, and snail control would also reduce transmission. So estimates show that at least 236.36 million people require preventive treatment for schistosomiasis in 2019. 105.4 people were reported to have been treated. So even the preventative measure was needed in a lot more. Only 105 people. Got it. So 105 million people. So what does this mean? There's also a nice interactive graph that if you want to take a look, you kind of can. And this looks at the different countries and just some of the indicators of specific diseases, and you kind of have to filter through looking for the specific disease that you are interested in, and then different maps. So I'm not going to go into too much about this, but just that it's there. And for schistosomiasis, the status of schistosomiasis indicated endemic countries in 2020. The ones in orange is the endemic areas. And then there's no PC required over here. Also in China. So there's different ways, and you can see as I'm going through this, multiple windows are getting highlighted. So it's an interesting dashboard. I'm not going to spend a whole lot of time here because there's another topic to cover. Here are the parasitic species, and they're divided by geographic distribution, so that one is good to do. But there's two major forms of schistosomiasis, which are intestinal and urogenital, and I'm going to focus on urogenital in a bit more, but it causes 5 main species of blood fluke, and the following are the 5. Only one type causes urogenital schistosomiasis, by the way. And then I'm going to talk about female genital schistosomiasis and what that causes specifically. But it's also considered urogenital schistosomiasis as a risk factor for HIV infection as well. The classic sign of urogenital schistosomiasis is actually blood in urine. What are the economic and health consequences? Well, it's a considerable disease that disables individuals and also kills. In children, schistosomiasis can cause anemia, even stunted growth, and a reduced ability to learn. although the effects are usually reversible with treatment. Chronic schistosomiasis, of course, may affect people's ability to work, and in some cases can result in death. Of course, the number of deaths due to schistosomiasis is difficult to estimate because there's hidden pathologies like liver and kidney failure, bladder cancer, ectopic pregnancies from female genital schistosomiasis. So here's the diagnosis. Use a Cato-CATS technique or a circulating cathodic antigen technique in order to look for some of the intestinal schistosomiasis eggs. And it's actually a methylene blue stained cellophane soak that you use in the fecal specimen. Prevention and control. There should be targeted treatment. There should be preventative chemotherapy in affected populations and at-risk groups, and I think it's similar to thinking about COVID. But also in a few countries, there's low transmission. So there's a pediatric formulation of praziquantel, which is the main therapeutic dose, and then it can be used for preventive chemotherapy as well. And so this talks about this. Now, the second part of this, I wanted to specifically go into female genital schistosomiasis, which is an important topic to be thinking about, and this foundation actually specializes in this. So I wanted to, instead of just going into the World Health Organization website, actually cover this here. And 56 million girls and women in sub-Saharan Africa are estimated to be affected by female genital schistosomiasis. This actually occurs in up to 70% of women infected by schistosomiasis. So anybody who is affected, any women who are affected by schistosomiasis, 70% of them may develop FGS. If FGS is underdiagnosed, then there can be serious complications to women's reproductive health, ectopic pregnancy being one complication, and then there being others. Unfortunately, FGS also leads to infertility and can increase the risk of HIV infection, which I went over before, but more importantly, female genital schistosomiasis is something that causes stigma. And so symptoms are similar to those caused by STDs, so there's stigma behind STDs, and naturally the female genital schistosomiasis would have stigma associated with it, which is unfortunate, but social exclusion occurs due to not necessarily the FGS condition, but the infertility that might arise as a result of that. And of course that would lead to marital discord and depression. So what are the symptoms of FGS? Well, if you see any, if you're in an endemic area, you don't just get concerned anywhere else. But if you see vaginal discharge, blood and urine, abdominal and pelvic pain, honestly, if you see discharge, then you should probably get that checked out anyway. But if there's certain types, and which is indicative of different types of sexually transmitted infections. But this is specific to the endemic areas of schistosomiasis. If left untreated, FGS can actually lead to infertility. Definitely not something that is favorable. Abdominal or ectopic pregnancy, abortion or ectopic pregnancy, genital ulcers, and of course, increased risk of HPV and HIV. Of course, there's a pocket atlas that, if you're a physician, I encourage you to carry around, and if you're actually practicing global health and overseas, then this might be, pamphlets are always good to carry around, because this is a quick kind of schematic of different types of lesions that are found in different portions of the body from schistosomiasis, and due to the poor familiarity of many people of this condition, this might be helpful. So this is kind of the picture of a normal cervix, and then this is a grainy sandy patch, and this is kind of homogeneous yellow. You see the yellowing pattern right in here. And then, of course, looking at some of the abnormal blood vessels, as you can see, this is abundantly clear. And then the rubbery papules, which develop. And then looking at some of these grainy, sandy patches, as you can see. And it's kind of difficult to see, but you can kind of see abnormal blood vessels. And then looking at some of these pathological grains again in here. And so these are all pathognomonic for people that have female genital schistosomiasis. This is looking at some of the blood vessels within, and then right here there's kind of a homogeneous yellow area, and so these are all pathological, and you can see some of the more pronounced ones. This one is homogeneous yellow sandy patch, and some of the more pronounced ones I can show you. This is a severe case of homogeneous yellow sandy patches and severe contact bleeding because of the level of female genital schistosomiasis. This is widespread abnormal bleeding, and so on and so forth. There's quite a few, and you've probably seen most of them. So these are actually, there's actually more than 10,000 colposcopy. So colposcopy is the scoping of the cervix, and there's about 10,000 images of that. And so it's good to go through these whenever you're trying to familiarize yourself, if you're a medical practitioner or student. It's good to go through histological patterns and pictures so that you can familiarize yourself with the different types of imaging. I think of all the fields, medicine is heavily reliant on being able to interpret pictures and images and just diagnostics imaging in order to be able to provide proper care. And so I've done, of course, I conducted some of these scoping, and then also looking under a microscope for different types of STIs, and different types of exams. So just going back to the main kind of symptoms and what is important about raising awareness of SGS and just schistosomiasis in general, due to the fact that it's so ubiquitous in sub-Saharan Africa. And so it's important through early diagnosis and regular treatment of schistosomiasis in women and adolescent girls. And it's kind of similar, the similar principle as HPV and a lot of these other diseases, which in turn can lead to improvements in their quality of life, and of course can avoid some of that stigma that is attached to infertility and other types of conditions that might arise out of FGS. This foundation is tackling by various initiatives. There's a position paper that they actually publish, which is important and interesting to be always going through, so that you can kind of see where the organization is coming from. The key messages, of course, are that the condition caused by the neglected tropical disease schistosomiasis affects the most marginalized and vulnerable populations. And we're going right back to the message of health equity, where they do not have access to safe water supply and sanitation services. It's a significant human right, development and reproductive health issue, FGS. It's underdiagnosed with serious long-term implications for women and adolescent girls' sexual and reproductive health. The symptoms and complications of FGS can lead to even poor mental health from the stigma and social exclusion that women and adolescent girls may experience. And then FGS is associated with increased risk of HIV, HPV. FGS can be prevented through regular treatment with praziquantel. And then finally, multi-sectoral partnerships and integrated programs are needed in endemic areas. So this sums up and provides really. I hope this is provided a really detailed overview of how schistosomiasis, number one, is a neglected tropical disease, and then how schistosomiasis affects the whole body, because it's a worm, it's a parasitic worm, so it affects the whole body. We went through some pathological pictures of female genital schistosomiasis, and then talked about how it affects everything within the body, so and causes inflammation. So I hope this has provided you with a wonderful overview of one of many neglected tropical diseases. Thank you for listening.